wabarakatuh. We talk about arm. The arm divided into two compartments, anterior compartment and posterior compartment. Start with anterior compartment of the arm. In the anterior compartment of the arm, we can find muscles, nerves, arteries, and vessels at general. Muscle of the anterior compartment of the arm, three muscles, which are coracobrachialis, brachialis, and biceps brachii. Biceps brachii, bi means two, ceps mean head. That means this muscle has two heads. This one is biceps brachii. When you cut the biceps brachii, you can see brachialis muscle. On the upper part of the medial part of the arm, you can see coracobrachialis. So this one is a coracobrachialis, biceps brachii, and this one is brachialis muscle. Biceps brachii has two heads. This one is a short head or medial head, which originate from the coracoid process of the scapula, and this one is a lateral head and short head, which originate from supraglenoid tubercle. This is a glenoid cavity. Above to it there is a small tubercle. It is named supraglenoid tubercle. The two heads join each other inferiorly and insert into radial tuberosity, and through the bicipital aponeurosis inserted in the skin of the forearm. Okay, the main action of this muscle is supination. Also, it assists in the flexion of the forearm or the flexion of the elbow. The long head here assists in the flexion of the shoulder joint. Okay, this one is the brachialis muscle, which originate from the anterior surface of the lower half of the humerus and inserted into coracoid process of the scapula. This is the coracoid process of the scapula, and here is the attachment of the brachialis muscle. The main action of this muscle is the flexion of the elbow joint. This muscle is known as coracobrachialis. Coraco originates from the coracoid process. Brachialis means humerus. Originate from the coracoid process and inserted in the middle third of the humerus. The main action of this muscle is flexion and adduction of the shoulder joint. Okay. The nerve supply of this muscle, all these three muscles supplied by musculocutaneous nerve with a continuation of the lateral cord of the brachial plexus. Okay. In the posterior compartment of the arm, there is a muscle which has three heads, known as triceps brachii. This triceps brachii has long head, lateral head, and medial head. The long head originates from infraglenoid tubercle. The lateral and medial head originate from the posterior surface of the humerus above and below the spiral groove respectively. And the three heads fused together and inserted into olecranum process of the ulna. The main action of this muscle is extension of the elbow joint and also assist in the extension of the shoulder joint. We have a small muscle here known as olecranum muscle. This muscle in subreference belong to the muscle of the forearm. Okay, this olecranon muscle is a small triangular muscle originate from the lateral epicondyle and inserted into olecranon process known as anconeus muscle, and also assist in the extension of the elbow joint. Okay, the nerve supply of the triceps by radial nerve. Okay, so all the muscle of the anterior compartment of the arm supply by musculocutaneous nerve, and the muscle of the posterior compartment of the arm supply by radial nerve. Radial nerve is a continuation of the posterior cord of the brachial plexus. We have another nerve in the arm but does not participate in the innervation, such as the median nerve. You can see in the cadaver this is the median nerve. How to identify this is the median nerve? Median nerve superiorly has two roots, from the medial cord and from lateral cord, join each other and run in the middle of the forearm. And here is the ulnar nerve. Ulnar nerve is a continuation of the medial cord and run on the medial border of the brachial artery. In the junction of the middle third with the lower third here, the ulnar nerve pierces the deep fascia and run in the posterior compartment and located here behind the medial epicondyle, and this is the most area for injury of ulnar nerve. Okay, the musculocutaneous nerve bears the coracobrachialis and run between the biceps brachii and brachialis muscle. The radial nerve run in the posterior compartment of the arm. Okay. Here, the radial nerve run in the spiral groove, and if the radial nerve injure here by the fracture, it leads to the paralysis of other muscle. Details about this injury later. Okay. The blood supply. As you know, we have subclavian artery. The subclavian artery originate from the heart in the right side, from the brachiocephalic trunk, from in the left side, directly from the arch of aorta. The subclavian artery at the outer border of the first rib change its name to axillary artery, and the axillary artery at the lower border of teres major change its name to brachial artery. So this one is the brachial artery. So the beginning of this artery, brachial artery, is the continuation of the axillary artery at lower border of teres major. So this is the brachial artery, which is a continuation of axillary artery, and terminate here in the cubital fossa. This fossa in front of the elbow, known as cubital fossa. The radial nerve terminates in the cubital fossa opposite the neck of the radius by dividing into radial and ulnar artery. Okay, so this is the brachial artery, continuation of the axillary artery, and terminate opposite the neck of the radius into ulnar and radial artery. The branches of the brachial artery include profunda brachii artery. Profunda brachii artery run in the posterior compartment of the arm in the spiral groove in company with radial nerve, and it gives rise to the radial collateral artery and medial collateral artery. These two arteries participate in the anastomosis around the elbow joint. Also, give nutrient artery to supply the bone, to supply the humerus, and give rise to the inferior ulnar collateral artery and superior ulnar collateral artery. This one is superior ulnar collateral artery and this is inferior ulnar collateral artery. Inferior ulnar collateral artery divided into anterior and posterior branch. Superior ulnar collateral artery, inferior ulnar collateral artery, radial collateral artery, and middle collateral artery. All these arteries participate in the anastomosis around the knee. So the main branches of the brachial artery is deep artery of the arm or profunda brachii, superior ulnar collateral artery, inferior ulnar collateral artery, and nutrient artery. Okay? The ulnar and radial vein join each other to form the vena comitant of the brachial artery. The vena comitant of the brachial artery joins the basilic vein to form the axillary vein. Okay? We have a fossa in front of the elbow known as the cubital fossa. This cubital fossa is triangular space in front of the elbow, has a base which formed by imaginary line that joins the medial and lateral epicondyle together. It has an apex which formed by the two muscles, pronator teres and coracobrachialis muscle. The medial boundary of this muscle formed by the lateral boundary of pronator teres, and the lateral boundary is formed by the medial boundary of brachioradialis muscle. This is the brachioradialis muscle and this is the pronator teres muscle of the forearm. The roof is formed by the skin and bicipital aponeurosis. It contains the median nerve and brachial artery, which divide in the cubital fossa into ulnar and radial artery. Okay? In the roof of this, there is a median cubital vein. This medial cubital vein connects the cephalic and basilic vein together, known as medial cubital vein. Okay? That is all. Thank you.